home, we're closely monitoring developments on the new and more infectious coronavirus variant first detected in the United Kingdom that is now in the Philippines. Let's find out more about the country's first case of COVID-19's UK variant when I'll talk to Health Spokesperson and Technical Working Group on COVID-19 variants, Co-Chair Undersecretary Maria Rosario Vergeire. Good morning, ma'am. Thanks for taking our call.
Good morning, ma'am.
So what do we know about the new patient with the new variant of COVID-19? Where is the patient now, ma'am? And have you monitored people around him exhibiting symptoms?
Yes, the patient now, the individual is isolated in a facility in Quezon City, and we have started our contact tracing among the different close contacts that we have identified.
I understand, ma'am, the patient has pneumonia and is now being treated.
Yes, he is still in the isolation facility in Quezon City. He has mild cough, and with X-ray results, it showed that he had pneumonia. So he's now being treated with antibiotics.
What about his close contacts, ma'am? Have they exhibited symptoms? And how many samples from his close contacts are you studying right now?
We were able to identify those very close contacts, those that he had the close contacts in his home, and we were able to take the swabs already. And these close contacts do not exhibit symptoms as of this time.
So, Undersecretary Vergeire, for the benefit of our viewers, can you tell us the characteristics of this UK variant? I understand studies show it's more transmissible and more infectious, but is it more deadly?
Yes, people have to understand that this new variant has the same mode of transmission. It is said to be more transmissible, but there is no evidence yet to say that it is more deadly. So our measures that we are currently employing just have to be strictly complied with.
Ma'am, are there changes in the mode of transmission? And will the DOH now recommend a continued travel ban even if the COVID strain has already entered the country?
Yes, as I've said, the mode of transmission is still the same. It is still droplet infection. So whatever measures that we are currently employing will still be the same, although we would like to emphasize that there should be strict compliance with the minimum public health standards, and we should avoid these areas where there are a lot of people. Now, with regard to the restrictions that we are currently imposing on affected countries, this would be discussed later this afternoon in the Interagency Task Force meeting.
Finally, ma'am, there are a lot of concerns about this new COVID-19 variant from the UK. Will the vaccines work against this new variant?
Well, according to our experts, the vaccines won't affect the efficacy of the vaccine won't be affected by this new variant. But of course, eventually, if this becomes longer and it becomes the transmission would be increasing, that has to be studied. But for now, even WHO is saying it will not affect the efficacy of the vaccines.
Finally, ma'am, just to be clear, you are monitoring only one case of the new COVID-19 variant?
Yes, for now, the results came out and we only have one individual who tested positive for this variant among the 500 plus samples that we have collected. But of course, we will be continuously monitoring.
Ma'am, what about, can we just get an update on the condition of the Filipina who arrived in Hong Kong, and Hong Kong authorities said she was positive for the new COVID-19 variant? What is the update on her?
Yes, we were able to talk with the authorities in Hong Kong, and apparently the individual is stable. She is inside the facility in Hong Kong, and the quarantine period that has been set for her is nearing completion already.
Is there an update, ma'am, on the contact tracing on the close contacts of the Filipina?
Yes, we were able to get samples among all of these contacts, both from Cagayan and in Manila, and all were subjected to this genome sequencing. And accordingly, based on the results, none appeared to have the variant also.
All right. Thank you for your time, ma'am. Thank you for joining us today. Health Undersecretary Maria Rosario Vergeire.